Our next presenter is Saurav Sengupta, founder and CEO of Small Joys.
Hi, Umi,
Saurav?
thank you. Yeah. Can you guys see my screen?
Yes.
Okay, cool. Hi, I'm Saurav Sengupta. I'm the founder, one of the founders and CEOs, one of the CEO at Small Joys. What we are building is a pediatric behavioral health company pioneering collaborative care. Pediatric behavioral health is in an emergency. We all know that. There are three distinct problems that we see around this particular phenomena. One is that pediatric behavioral health is not measured appropriately today. The second is there is a huge demand supply gap of behavioral health specialists, and behavioral health is mostly provided in a silo. The solution that we are developing addresses each of these three unique challenges that has created the problem in the first place. Our go-to market is through pediatric practices. Collaborative care model works through primary care pediatricians, where a primary care pediatrician, a behavioral health therapist, and a psychologist and a psychiatrist come together, share data, and address the whole child as we know it. Our initial focus is primary care pediatric practices without any behavioral health integration today. The way collaborative care model works is it starts at the pediatric office. There are automated intelligent screeners that we have built that can collect rich data set around behavioral health of a pediatric patient. That data in real time goes to a pediatrician who can see this data, offer better diagnosis real time by incorporating several mental health indicators. After the child is identified with certain behavioral health challenges, then we offer them our program, which is a combination of digital intervention through our app and therapeutic interventions such as individual therapy and group therapy. All of this data is collected through our proprietary algorithm developed within the natural language processing setup and offered to the therapist and the pediatrician to measure and monitor behavioral health outcomes. Our intellectual property, what we have already developed, is real-time behavioral health measurements. Even though there are so many different emotional AI platforms today, Google has one, Amazon has one, but none of those are actually trained on a pediatric population. And that's what we have built. We have built a pediatric population focused behavioral health measurements. Our IP has already able to provide sentiments, emotions, and stress related indicators. And we are currently working on mental illness related indicators. The accuracy of our AI is around 92%, which can be comparable to a trained psychologist. The unit economics around collaborative care model is very strong. On an average, from 40 patients, we generate around $76,000 to $80,000 a year, which is then split between Small Joys and the pediatrician through which we are launching the product. As I mentioned, our initial obtainable market, serviceable obtainable market is with the primary care pediatricians who do not have a behavioral health integration, and that number is around 15,000, and our total market size become 634 million. We have already launched in one pediatric practice and are serving around 30 patients on a weekly basis. Our 5-year projection, which is around 20% of our SOM, is to get to 8 million monthly recurring revenue. And to get to 8 million monthly recurring revenue, all we need is 105 pediatric practices to be in our network. There are many competitors in this landscape. Actually, youth mental health or pediatric mental health has become a very hot space over the last few years. So there is obviously a lot of competitors here. But if we look at the measurements of behavioral health. There is literally nobody who is actually measuring pediatric behavioral health. We are utilizing our collaborative care model where the payers are insurance companies, and our customer acquisition cost actually is $0 because the top of the funnel is through a pediatric office. We have an interdisciplinary team. I am the CEO. I worked predominantly in insurance companies, investment banks to work on deploying capital based on risk-reward trade-off. Dr. Jariwala is also with us today. He's a pediatrician. He has been running his own pediatric practice for the last 30 years, and he's our chief medical officer. We also have Sham. Sham was the head of engineering at NBC Universal, where he led the development of Peacock streaming services. He has left NBC and joined us, working full-time on Small Joys. Geet has been building AI models and data science models for the past 15 years. She's our chief AI officer. We have Karina Barrow and Kristen, who are our clinical psychology team. Karina has been a school psychologist for 15 years, understands this demography that we are serving really well. And Kristen is primarily focused on the clinical outcome and clinical efficacy measurement of our program. We are currently raising 1.2 million seed, out of which we have already raised 560K. The primary focus of this round is to get us to profitability. Once we get to about 90 pediatricians, we get to profitability. The other ask is to connect with primary care pediatrician, and we want to build it in the next 6 months. We want to reach to about 50 primary care pediatrician. Happy to answer any question that you have.
Great. Thank you very much.